Hello, future awesome nurses. I am here today because I want to help you prepare for your first day of nursing school so that you don't get behind. If you're watching this video, then that means you got into nursing school. That's me being happy for you that you got into nursing school. And that's also a little nod to my student from last semester. You know who you are if you're watching this. Anyways, I'm currently on winter break, which means you guys who know you're getting into nursing school are starting school in just a few weeks. So if you're watching this video, I am going to tell you some strategies that you need to start now so that you are ready when the first day of school starts. Who am I? My name is Jamie. I'm a registered nurse. I've been a nurse since 2006. Now I am a nursing professor since 2012, all the while staying in the field of nursing. And I also have worked as managers of education and education departments. I've done hiring for new grad residency programs in hospital settings. I have taught numerous courses at multiple universities. So I know what it is like to start out new in a nursing program. I know you're anxious. I know you have a lot of questions, and I want to help sort of ease some of that for you and also help you so that everything is kind of set and ready to go before nursing school starts. Because once nursing school starts, you do not want to be stuck filling in some gaps that you were unable to accomplish over the break. So let's jump into this so that you are ready to go. And you guys can stay till the end or even fast forward to the end, and I have a little pep talk for all of you should you need it as the semester continues. Okay, the first thing that I really want to make clear to you guys is that nursing school is not like other courses. So in order to get into nursing school, I know you're smart. I know you have taken classes, you've written papers, you got through English, you got through chemistry, you got through the biologies, but nursing school is different. In your other classes, you could kind of like go to class and study and take tests, and if you got behind, you could make it up, you could maybe miss a day. You know, in college, no one's looking at who's on the attendance books. You could miss a day, get notes from a friend, everything would be fine. Nursing school isn't like that, and you need to know that from the beginning, because when I see students who fail out of nursing school, it's not because they're not smart. It's because they fell behind in the beginning and could never recover from that. And I don't want that to happen to you, because it always breaks my heart when I have to make that phone call that they, did not pass the class at the end of the final. So if you have entered a nursing program, I am sure you have a long list of things that you need to get done before the nursing program starts. And for the students who do fall behind, a lot of the times it's because they did not do all of the things on the list, so now they're scrambling to get things done on top of studying, practicing for skills, getting ready for exams, and it just becomes too much. So that's why I'm making this video. I want you to do all of the stuff that you need to do before school, so that once you get into the program, you can focus on reading and doing the homework and studying for the skills, and that's all you need to worry about. So first things first, you need books. You will have a list of textbooks that you need to purchase. You want to purchase those as soon as possible. If you have access to the course syllabus, I really recommend that you go and look at the first few weeks of the course so that you can start reading ahead of time. Nowadays, there are different ways of getting a textbook. You can rent a textbook, you can buy the hard physical book, or you can get the online version of a book. And that, if you do the online version of the book, it sometimes comes with resources and quiz banks and practice questions. I can't speak for all the other schools, but it's pretty safe to say if you're starting in first semester nursing and you want to get ahead and you want to read a couple of chapters before school starts, if you start with safety and you would start with infection control, you should be okay, because those are initially what we introduce our brand new nursing students to before we can start anything really. Okay, next, you need your uniform. So you have to wear a uniform when we go to the hospital or the clinics for our patient care experience, also known as clinicals. I can make a whole video on surviving clinicals. Let me know if you want me to make that in the comments below. So your school will send you all the links to buy your uniforms. Usually your uniform is gonna come with a scrub top, scrub bottoms, and then a requirement for the type of shoes that you wear and a name tag. Items like your stethoscope, your blood pressure cuff, a watch, bandage shears or scissors, but they have to be special, like bandage shears, a pen light, and you need an automatic pencil and a black pen. So let's go through a few of those items in a little bit more detail. I want to start with your name tag. Your name tag, you can probably just get away with ordering one, have your name tag, switch it on different uniforms on different days, but I highly advise you, if you have a strict school, like the school that I teach in, sometimes you get sent home from clinical if your uniform is not complete. So you'll want to have 2 or 3 of the name tags, just in case you lose it. You don't have to stress. The watch. A lot of hospitals will not allow students to have Apple Watches, smartwatches, smartphones in the hospital setting due to HIPAA rules. So HIPAA, real quick, is just patient privacy. It's just too risky to have students with phones, smartwatches, getting text messages while they're taking care of patients. A good watch to buy would be just a cheap one with a swiping second hand. The reason why I say swiping is because you're going to learn how to take vital signs, and when you do, if you have a second hand that's going 1, 2, 3, 4, you'll count the second hand and not the actual heart rate or pulse that you are listening to or feeling. So get one that just sweeps. It doesn't have to be anything fancy. I think that you can find them for like $5, $6 on Amazon. Get comfortable shoes. Your school may require a certain color. Never ever want to have shoes that have a mesh top. And the reason for this is because body fluids will sometimes get on you, on your feet, and you don't want it seeping through your mesh into your socks and all between your toes. I learned this the hard way. You need a stethoscope. If money isn't an issue for you, I really recommend the Littmann. Where's my Littmann? This one in particular, because this one is very light on your neck. Like you'll find when you get your stethoscope and you put it on your neck, it takes a while to get used to it. It actually can be kind of heavy. So this one's really light. I got this, I think I bought this at just the uniform store, and it has a swivel head so you can listen to murmurs and stuff. You need a manual blood pressure cuff for first semester, and this is just the blood pressure cuff with the dial on the cuff. You don't want one that has like an electronic reading blood pressure cuff. Next is your health and safety requirements. This is one that causes my students the most stress, and all hospitals require it, all schools require it. Let me tell you what they are and a little bit about each one. You of course need to look at your own school's policies and procedures on getting these done, but I will tell you what is required where I teach, and I've taught at a few different schools and it was all the same. Number 1, you will have some kind of platform where you need to upload these documents. So whether it be Castle Branch or a Complio, something like that. And the platform will have areas that say whatever vaccine it is, and then you have a place to upload it. Please make sure when you upload any of your documents, your name is on the document. Otherwise, the platform will kick out your stuff and not approve it, and then we can't approve it, and then you can't go to the hospital. And then you're having to call the company, have them take down your first upload and re-upload things. As you can see, this is a cycle you just do not want to get into. Listen to what I am saying and do it right the first time. Your school will have a list of the vaccinations and health and safety requirements that are required for you to go to clinical. You have to have measles, mumps, rubella varicella, and hepatitis B titers. A titer is a lab that is drawn, and it gives a value that shows whether or not your body has made antibodies and you are immune to these disease processes. Get this titer drawn first. And then the titer will say you are immune or you are not immune. If you are not immune, you have to start the whole series of these vaccinations again, or possibly for the first time, depending on your history. And that takes time. All of this takes time. So if your school starts, let's just say your school starts at the end of August. If your school starts at the end of August and you wait until the week before the end of August to get any of this done, then you can see you're scrambling to get it done. It's very stressful. So you need measles, mumps, rubella, varicella, hepatitis B titers. Then you also need the tuberculosis screening, or otherwise known as a TB test. So there's a few different ways which you can accomplish achieving the requirement for the TB test. So you can get the PPD, which is the little blip that they put right here on your arm. So when you get that test, you have to have the test done at a doctor's office or a nurse's office or a clinic, and then 48 to 72 hours you go back and have it read. So if you're gonna go down that route, then you also need to get a second one. So a two-step TB test is required when you're entering a nursing program. So you'll get that first one, 48 to 72 hours later, you'll have it read, and then 7 to 21 days later, you have to have the exact same test done again. That is what is known as the two-step TB test. You can see again, this takes time. So don't wait. Do it right now before school starts. If you are unable to do the two-step TB test, either you've tested positive for TB in the past, or there's some other reason why you just can't have it done that way, you can get the QuantiFERON. That is a lab test. It will say whether or not you're positive or negative for TB. If it also shows that you are in the range of positive, that doesn't mean you have TB, but then you have to additionally get the chest x-ray. If you're going to submit a chest x-ray, there is a form that you also need to fill out and submit with that chest x-ray. Tetanus, which is due every 10 years, unless you get some kind of injury, and then it would be sooner. You need a flu shot. You need the COVID vaccines. So COVID vaccines for nursing school and hospital settings up until recently. If it changes, look at your school policy, but up until now it has been you need both COVID vaccines, only one if you have the Johnson & Johnson, but then you also need that booster. For the most part, we need the 3 shots of the COVID vaccine. You also need liability insurance. You can get this through NSO. This is student liability insurance. You buy the student liability insurance and your school will tell you what type of package you need to buy, but you have to have that. And then your school may have you upload other things into the Castle Branch or Complio platform, such as a simulation hospital agreement, oath of confidence agreement, signing off of the student handbook or something like that, and a physical examination. So the physical examination you can have done at your doctor's office, or sometimes your school will have a student health center, and then you can get that done for a lower cost. One more thing on the health and safety requirements. This is going to be your life from this point on in nursing. You're always going to have your basic life support or BLS. You're always going to have to get a flu shot. You're always going to have to present your titers. As you move on, you're going to get even more certifications. Your RN license, your advanced cardiac life support. So start now and save these documents to your computer. Get a program such as like Cam Scanner or some kind of scanning software so that you don't take a junky picture that has shadows all over it, but rather you scan the document and upload it to your computer, save it with your first and last name, the name of whatever it is, BLS, flu, and the year. Things will creep up on you. Most things are due every year, every 2 years. And if you just look in your computer and see, oh, I got my flu shot in October of 2023, you know you have to get another one before October 2024. Don't want to fall behind, because then you won't be able to go to clinical. If you're in the hospital, you'll be put on suspension. Do yourself a favor and get a good filing system going right now. And no junky pictures and uploads. It's a good idea to keep all of the hard copies in a folder somewhere as well. You will need some kind of computer, whether it be an iPad, a laptop, a PC, Mac. You will need some type of computer. Something that I see a lot of my students with is the iPad. They have recommended actually the iPad Air and the little pencil, and they just take notes right on it and it saves it. And it's nice because a lot of the documents that you have to submit to your nursing professors are uploads, and sometimes they have to be handwritten documents. So if you have that, then it's already saved to your computer. You don't have to worry about scanning stuff in, and that is something that I have seen more and more, and I actually want one myself. Okay, so are we ready for the first day of school? I think we are. Alrighty, so here's the first day of school. You're going to enter the first day of school possibly not knowing anyone in your nursing cohort. My advice to you is be open and make friends. You need friends in nursing school. I haven't seen anyone yet who hasn't made any friends. You just are sort of forced to. You're thrown together all the time. You go to school every day together. You have to practice skills on each other and listen to each other's heartbeats and feel each other's pulses. So you do become friends. But in my classes, I categorize my students, and they know this. I'm not trying to be offensive, but there's the noisies and the quieties. And the quieties sometimes do themselves a disservice because they are quiet. They don't speak up in class. They don't seek out help. They don't come and talk to their professors, and as they're sliding behind, they're not coming forward and saying, hey, I need help. So as much as you can, get out of your shell, advocate for yourself, be there for yourself. Your professors won't mind. I promise you, we won't mind. We want you to succeed. We don't look very good if you guys don't succeed in our class. So we want you to succeed. Okay, now I put on my nursing garb, so it's time for the pep talk. Okay, you guys, if you've come back to this video because you are already in nursing school and you're getting so overwhelmed and you just feel like it is so hard and you don't know what to do and you're feeling discouraged, I want you to think back as to why you went into nursing in the first place. Usually because you wanted to help someone or you enjoy helping people. Nursing school is a lot of learning. It's a lot of test taking. It's a lot of skills practice. It's a lot of stress. We all have to go through nursing school in order to be a nurse. Hang in there. You got here for a reason. You worked your butt off to be here in nursing school. Do not give up on yourself. Keep studying. If your study group isn't working for you and you're not doing well on your exams, find another study group. But look around at all the other people in the cohort, at all of the people in the semesters before you. They've gone through this semester that you've gone through. Reach out to some of them. Try to talk to them in skills lab and see, hey, how did you deal with this certain instructor? Or what can I expect when I go to clinical at this facility? And they help. I've seen it. People are too afraid to ask, but once you do, those people who have experienced this, they want to share their knowledge with you. They're like, yes, I made it. I know how you feel. So reach out to your peers. Keep working. Take breaks for yourself. People are watching you. Your family is watching you. Your children are watching you. Your friends are watching you. And you can do this. Take a deep breath. Go on a walk around the block. And know that you are in nursing school because you worked hard to get here. And you're not going to let anyone or anything stop you from achieving this goal. Okay, now let's get back to studying.